Hi all. Actually, there is a lot of confusion in between the name bone alignment therapy. So we are actually having the trademark and copyright in that name, so that legally no one can use that name bone alignment therapy. So that's a technical area. We are not much fights on that area, but some people are using that trademark names without our permissions. That's what happening in some places. So that's the confusion maker. So the major question today I have to answer. A lot of people are asking that bone element therapy is useful for which all problems. That's what major question is coming up. So when you're looking at that, when there is a structural, usually we can say that back pain, there is pain and sensation on hand, leg, and numbness, sensations and tingling kind of things are there. Uh, that might be also with the bad. That's all we can say, because from your brain to your all organs, there is a connection from the spinal cord and spinal nerve. So when you are having a eyesight problem, so that problem also will be taken care with the bone alignment therapy. Why? Because there is 100 reasons for a eyesight problem. There is one problem can be a nerval compression on the C2C3 belt. So when we have a cervical compression, that can lead to an eyesight problem. So that is maybe out of 100, that's a one possibility. So there is a lot of other possibilities are there for an eyesight problem. So one of that is a nerval compression. So as like that, when your all organs are connected with brain, whichever organs are not connected with brain due to this disc bulge and nerval compression, that organs also will not work in a proper alignment. So what will happen, that that rhythm of the organ will not be in proper way, so that it will affect into some disease condition. So what happened here, if you are treating in an organ problem also, that organ problem will not be solved due to the problem is not an organ problem. It is a problem that the brain is not connected with that organ, and that communication procedure is not proper, so that there will be some error. So that errors also you can solve with the bone alignment therapy. So we are actually not in a structural level, but when there is a lot of organ connected problems also can be addressed in bone alignment therapy. So usually as a joke we will say that you can solve all problems, all diseases in bone alignment therapy, but everything cannot be. So that's the usual practice we make. So if that's stammering, if there is snoring, or else if there is a liver malfunction, kidney malfunction, whatever it is, it all can be addressed with bone alignment therapy if it is the problem with the brain to the particular organ. So we should do address in such a way. So I can tell you a small example. When we had a trainers training program at Adirapalli, one girl came up. She had some, I think, 17-year-old. She is in +2. So she came with a problem that she have a swelling over knee, so she cannot walk properly. So they gone for some 7 years with different major hospitals. So they're all checking their virus problem. So end of the day, they are getting a result that there is no virus infection, and they are going for the checkups. So what happening end of the day, when I am looking at, she actually having the habit of making the curvature, and she is studying like this. So obviously what will happen, it is affecting in the lumbar region. So maybe that 3, 4, and in between 2, 3, 4, in between there is a nerve. It can be affected in the knee region. So that problem is the actual reality, but the checking is happening at somewhere else. So what the problem is, I'm just made a roller and I just put it under her lumbar region, so that kyphotic is generated and the lordotic is generated. So when I asked her to just try to make a walk after just a 2-minute roller program, she just walked and she told my pain is gone. So it can work like that miracle. And the next day also she got another scan, like a blood report. There is no virus infections not found. So you can change the entire procedure in a different manner. So there is a lot of other situations. If there is a liver problem, liver having a lot of other reasons to be having a problem, but there is one problem can be connected with the spine. there is a nerval compression possibility. So if you are looking at people, they will have a lot of breathing problem. They have palpitation situations are there. If you're looking at their body, they may be having some round shoulder. They will have some hyperkyphotic situation. So that scenario, they will have a very short breath will be there. So when they are having some difficulties in breathing, like some mucus situations are there or some cold is there, that time their breathing will be very difficult. So they have to breathe without the proper structure. They will have a breathing problem. So if you're correcting the structure, their breathing problem will be over. So we have a very different attitude, different perspective on about all diseases that can be handled in bone element therapy. But that never means if you are having some organ problem, we cannot solve that. If the organ problem is connected with the spinal nerve or spinal cord and brain, it can be reinstated. That's what actually bone element therapy is doing. So thank you all. Thanks for watching.